This is an introduction to SockIt oral hydrogel wound dressing. It's a safe and effective dressing that's applied in the mouth. There are two things that make SockIt unique. Number one, it's completely drug-free. The second thing is comprised of 100% all-natural food ingredients. I'm not aware of any other product on the market at this time that can make that claim. There are some products that are 100% all natural, but none other than SockIt that I'm aware of that is all natural food ingredients. These ingredients are extremely safe as well as effective. There is a tiny bit of essential oils in each 10-gram syringe of SockIt, way less than a fraction of a percent, and much smaller than the concentration in the food source. Essential oils that are found in foods are obviously considered safe because they are in foods, and obviously if you have a smaller concentration than that found in the food source, it's going to be safe. Xylitol is also in SockIt. It's one of the sugars that's known to help prevent tooth decay, and it's used in otitis media prevention. It would take a couple of hundred syringes of SockIt to be ingested at one time to get the gastrointestinal distress that xylitol can cause, so it's very safe in that regard. Acetylated mannans are also in SockIt. These are complex sugars that are found in various plants, and there is no known oral toxic concentration to the specific mannans that we have in SockIt. So SockIt is an extremely safe product. The three things that SockIt does very effectively is, number one, it helps alleviate pain of injuries of the mouth without causing numbness. Again, it doesn't have any drugs in it, so it doesn't have any anesthetic, and you don't get the numb sensation. You just get an analgesic type relief without the anesthetic effect. Secondly, SockIt helps prevent microbial contamination, which is very important, obviously, in wounds. And thirdly, SockIt optimizes the wound healing process. You do those three things, you really benefit the doctor as well as the patient. When you have happier, healthier patients, then you're going to have fewer complications, and there'll be fewer calls and less unproductive chair time dealing with patients who are coming in with post-operative complications. The last thing also is most dentists and oral surgeons, etc., use this as a profit center. You can charge for the service, and the dental code 9910 is that code that is used most often. Okay, the use of SockIt. Whenever you do a procedure, for example, a tooth extraction, or any other kind of procedure like that, you want to use and apply SockIt at that time, and the reason is that you want to address bioburden or microbial colonization as quickly as possible. We'll talk about that later in the presentation, but it's very important in wound care to address bioburden as quickly as possible. Obviously, they're anesthetized, so it's not used as a pain gel at that time. You then send the remainder of the syringe of the gel with the patient to use at home as often as needed for pain relief. And then it says true PCA, it's true patient control analgesia. They can use it as often as they need. There are no limitations to how often it can be used. And obviously they'll use it as often as needed for pain relief the first day or two. Patients need to be told to use it at least 4 times and preferably 4 to 6 times a day after pain isn't an issue so much, because they need to use it as a wound dressing, which again helps prevent microbial colonization and to optimize the healing process. That's where you see the real reduction in post-operative complications. So they need to use it until the syringe is completely empty. This is a slide showing it's being applied in an extraction site just before you have the patient bite down on the gauze. You send it home with the patient to use as often as needed for pain relief, and then after pain is not an issue, to use 4 to 6 times a day as a wound dressing to protect the wound. SockIt is especially good in immediate denture cases at the time of surgery, and when you're ready to deliver the denture, just apply the gel to the denture instead of the extraction sites, and go ahead and apply the gel and then deliver the denture. The difference with this is we historically have always told our patients not to take the denture out for the first 24 hours, and the reason is we're afraid they'll leave the denture out and then there'll be swelling and they can't get the denture back in, and it really causes problems with the healing process. With SockIt, go ahead and tell them they can take the denture out. They'll usually get 4, 5, 6 hours of relief, and then the pain relief, and then when the pain starts to come back, go ahead and tell the patient to go ahead and take the denture out very gently, to clean it, just rinse it off, dry it off, and put some fresh SockIt gel back in the denture. They will put the denture right back in because they want that pain relief that they receive from the gel. We haven't had a case yet that we've heard of where a patient did not put the denture in. They need to do that again before they retire at night. They will get a reasonably good night's sleep, more than you would expect, and then come in at the 24-hour recall looking very nice, and then come in at the 1-week recall, and we keep hearing that patients look like they've been healing for 2 weeks or more, and they do very nicely. But go ahead and use it in the immediate denture and have them go ahead and replace it as needed for pain. Okay, and also it's very useful after implants. A lot of people send patients home with other products to help prevent microbial contamination. A lot of these products don't taste well, and you don't get great patient compliance, and you don't get the benefit that you want. Go ahead and use SockIt. Go ahead and place SockIt in the site before you place the implant, and then go ahead and apply SockIt to the exterior just like you normally would. Send it home with the patient. Have them apply it 4 to 6 times a day. Again, as a wound dressing, it'll help prevent the colonization and help with the healing. We can get really good reports on the results that we see with SockIt in dental implants. And again, with soft tissue grafting procedures, just place the SockIt on the wound bed before you place the graft material, and then go ahead and use SockIt around that material, and then send it home with the patient to use as often as needed for pain relief and to help with the healing process. And of course, it's a very good product to apply to the donor site, which usually is very, very tender. So there are no limit really to the applications of SockIt in intraoral lesions and injuries that one comes across daily in the mouth. Okay, on our next video, we'll talk about issues with wound care and some of our thinking about the science behind the development of SockIt.